I would say that surprising differences in individual comorbidities across the spectrum of disease were occurring. So we found systemic differences in many comorbid conditions, really highlighting and reinforcing the systematic risk of inflammation brought on by rheumatoid arthritis. We also thought that the differences in comorbidities from the time of diagnosis was interesting. So the decrease after diagnosis showing a possible effect of treatment and improvements as a result of treatment. And finally, I would say that we were surprised to see how early the observable differences between RA patients and non-RA patients occurred. That was definitely an interesting finding for our team. So some of the sharp rise is attributable to the accrual method. So because it's an administrative study, you need to have interactions with the healthcare system to actually be identified as RA. But even controlling for those identification increases, we can see that RA patient healthcare utilization becomes more intense at the time of diagnosis, again, likely due to an increase in unexplained symptoms and patients seeking a diagnosis for the disease. And a sharp fall immediately afterwards. Again, we know that early aggressive treatment are effective treatment strategies for RA. So we are hoping that this is showing the benefit of treatment. So a reduction of healthcare resource use and a reduction in comorbidities brought on by treatment and identification of the disease. So we tried to get at this aspect by looking at the diagnosis year. And I'll say that there are many care improvements brought on in recent years for RA patients, like early aggressive treatment strategies, the early use of triple DMARD therapy, which could all be explanations of the effect of later calendar years having more decreases in comorbidity after diagnosis. However, there's certainly a component suggesting that new treatments like biologics and JAK inhibitors for RA are at least partially responsible for these improvements. We did note in our study window the substantial increase in the use of biologics because 0 patients had biologics before 2001. And by 2015, we had at least 30,000 estimated users in our cohort. So it's certainly one of the explanations for a decrease in comorbidities over calendar time.